Hi, this is Dr. Daljeet Kaur. I'm a consultant psychiatrist and founder of Dawn Healthy Minds and Dawn Welfare Foundation. I've been doing various videos on mental health issues and I've actually got very positive feedback and people are wanting to hear more and more videos. So I thought, why not? Let me start. So today's topic that I have chosen is about baby blues and postnatal depression. I've had couple of young mothers come to me soon after the delivery, and within a week or so they feel tearful. I mean, there's so many other contributing factors. I think a lot of focus is on the breastfeeding because they feel guilty that they're not able to feed the baby properly. They've just gone through such a big change in their life. They are mothers for the first time, all the families around. So, the whole environment is very different, and it does take time for a young mother to adjust to the hormonal changes that she's experiencing, all the physiological changes in her body, and also the changes in the surroundings. It can feel quite overwhelming. So, the first week post delivery, many of the women can feel tearful, overwhelmed, emotional, and that is what we call baby blues. So, baby blues can be managed by yourself and family around you if you get enough support and people around you understand. You would also need some assurance from professionals. It could be your obstetricians, it could be psychologists, it could be psychiatrists. However, if you feel that baby blues are not getting better even after a couple of weeks, then it may be a sign of something more serious like anxiety or depression that you might be developing, and that might actually need treatment. Let us understand what is postnatal depression. Developing depression after your baby is born is called postnatal depression. It usually begins sometime during the first 6 months post delivery of the baby. Postnatal depression can last for more than a year if it is left untreated, but if it is diagnosed earlier and treated quicker, the people tend to recover quite fast. Symptoms that might indicate that you're depressed include feeling very sad or hopeless, negative thoughts about yourself, lack of motivation, not sleeping well, lack of interest and pleasure in activities that you enjoyed earlier, loss of appetite, probably irritability in your mood, and so on. Now, a small proportion of people might also develop postnatal psychosis or puerperal psychosis that you must have heard. And this is something that I want you to actually take seriously. So actually 1 or 2 in every 1,000 mothers might actually go through puerperal psychosis. But it needs to be addressed soon, because here the mother might actually have negative thoughts about herself and also the baby. She might feel like either harming herself or harming the baby also sometimes, because she's experiencing psychotic symptoms. So she's not probably in a state of mind to look after herself or others. And the symptoms you would watch out for, feeling very irritable and angry, feeling unable to cope, maybe hearing voices, having some beliefs that the baby is not the baby, or feeling a bit paranoid. And some symptoms of depression could also be there, but it is something bit more than that. The person might seem a bit lost, not in this world, that kind of thing. So this does not make a mother a bad mother. This is only because she did show some symptoms and we've not treated it, and it's probably led to postnatal psychosis. This is very much treatable. We need to start her on medication and you will see a change in probably a week or 2. This also does not stop this mother to be able to look after the baby in the future. She can absolutely do all the things, but she would need support from the family. But symptoms need to be picked up by the family and they need to see a professional. In summary, I would like to tell you today that 20% of the women are likely to develop mood and anxiety disorders in the pregnancy, even if they've had no past psychiatric history. So this is now applicable to everyone. It's not just for people who have mental health issues. So let's understand that. The next thing is, if you've experienced depression in the past, you're more likely to be depressed in pregnancy. If you've experienced postnatal depression in the past, then your chances of developing postnatal depression in subsequent pregnancies are high. Therefore, anyone with past history of depression or postnatal depression should always consult an obstetrician and psychiatrist throughout their pregnancy, so their mood can be monitored. And at any point where intervention is required, whether it is just psychological or medical, things can be started soon. There are various medication that can be used in pregnancy and breastfeeding if required, because maternal mental health is very important. If you're letting the mother suffer throughout the pregnancy, it is going to have emotional effects on the fetus, on the baby as well. Therefore, it is better that you discuss pregnancy with your obstetrician and psychiatrist so you're monitored well during the perinatal period. So to all these young mothers, please think before your pregnancy, be under careful monitoring, enjoy your pregnancy, but if you're going through any symptoms, you're going through low mood, anxiety during pregnancy and all, please do not hesitate, go consult a professional. And then, I really want all of you to just enjoy your pregnancy and have healthy babies, and you yourself stay healthy in your mind and body. I hope you found this video helpful. If you would like to hear further videos of this kind, please subscribe to our channel. Have a good day. Bye.